Good morning. I'm Holly Tanner with the Herman and Wallace Pelvic Rehab Institute, and I'm here with Frank Ciuba, who is one of the instructors on the osteoporosis course. Frank, can you tell us your elevator speech when someone says, "Oh, this class, what is it about, and what do you teach people?"
Well, Holly, thanks for having me here. And I've been teaching some form of an osteoporosis course for almost a decade now. This course, though, is the latest up to date research compiled by my partner, Deb Gulbrandson, and myself in the management of osteoporosis for clinicians. And it could be either occupational therapists, physician's assistants, primarily physical therapists are our main audience. So it's an exercise approach, but I tend to tell people it's an A to Z, all right, because it includes everything. When physical therapists go to school, they only get a small amount of what osteoporosis is. They get very little to know of how to treat a patient. If we know from the statistics that 1 in 2 women over the age of 50 and 1 in 4 men over the age of 50 will have osteoporosis and or an osteoporosis related fracture at some point in their lifetime, that is a huge target market. And not knowing how to treat these individuals properly from a positioning standpoint, a body mechanics standpoint, but more importantly, the right exercises to do is what Deb and I try to teach basically in our course. So what's different? First of all, every patient in the program for the most part starts on their back. We've all heard that for osteoporosis, you want to do weight bearing exercises. Well, quite honestly, you want to do unweight bearing exercises. You don't want to load or compress the spine. You want to unload the spine. And these are all concepts that are sometimes new to clinicians and they don't really understand. In addition to that, that flexion based exercises, many of which are done in yoga courses, are contraindicated for somebody who has osteoporosis. So, in essence, that's what it is. We talk about the American College of Sports Medicine guidelines for strength parameters for strengthening these individuals because they're not the same as somebody who walks in a gym. We delve into nutrition a little bit. We state that we are not nutritionists and we're not nutrition experts, but we get this question a lot, and we feel that the information we present is pretty good as far as a baseline for you to discuss with your patients. We also talk about the pharmacology, the pharmacologic management of an osteoporosis patient, what the medications actually do so that you can have a constructive conversation with your patient about what's happening, and it helps them to possibly make a decision whether they want to take the medications or not.
Wonderful. And what is your passion? What's your interest in this particular population and work?
Well, it's interesting because the majority of people that are in the physical therapy profession are actually females. The majority of people who take this course and or have taken the work of Sarah Meeks, who is our mentor, are females. Now, I'm a male. I became interested in it when I learned that 1 in 4 men statistically will get osteoporosis or an osteoporosis related fracture in a lifetime, and they're really not being identified. So that was something. The second thing is the power of the ability to change the curve. When we look at a person who has osteoporosis or starts to get an increased what we call kyphosis, they're the typical person who tends to be older and their spine looks like this. It bends. They lose height. They'll commonly come in and say, I've lost height over so many years. The physician tells me it's nothing I can do about it. It's part of aging. Voila, there's a lot you can do for it. We've actually had people increase their height by 2 inches, getting 2 inches taller through this program because we're influencing the muscles that attach to the vertebral bodies. That's a very powerful tool that we as clinicians have, and we can offer that to patients. But we can also talk to the physicians about the fact that, listen, we understand that you're going to handle the pharmacologic management, but by exercise, we can actually change the way somebody physically looks. And who doesn't want that in today's world?
That's wonderful. And I think in terms of pelvic health populations as well, we see in the literature that the level of kyphosis can even affect things like pelvic organ prolapse. And certainly, I'm sure you talk about breathing and its
Mhm.
capacity in relationship to
Yes.
uprightness and all those the wonderful pieces of the puzzle that you'll cover. What are the patients saying to you that really continues to inspire you? And what's the feedback you get from them? Because so many patients, again, in addition to what we've been taught, many of the patients have only been taught fear. about this condition,
Exactly.
right? And so, what's the feedback you get when you present to them this menu of things that they can do across a lifetime and things that they can keep returning to?
In the physical therapy profession, I guess I'm biased. I think that we're excellent patient educators.
Mm,
We tend to spend an awful lot of time with our patients, and I think the one thing that's really powerful about our profession is that we need to engage our patient and have them educated and have them understand. So the first thing is that indicating to them that they can take an active role in improving their health is very, very important. Because let's face it, a typical visit to a physician might be focused around them having medication. So now they're taking a medication, they're depending on the pill to do work. But through an exercise approach, you have control. So when we tell them that we're going to teach them this method, so to speak, this exercise method, that they can have greater control in their curvature and their overall health, they're wowed by it. The second thing is that we tend to show them images or pictures of people who've gone through the program.
mm,
So a picture is worth 1,000 words. They see the change. And you just alluded to breathing. We talked to them about the fact that if they're having labored breathing, for instance, walking around the block and they have to sit down, they're tired, not only will this program help their breathing, it can also help them with their digestion, their
mm.
ability to swallow. These are a lot of issues that we talked to them about that they didn't even realize that an exercise program can help them with. They like also the fact that it's an extremely user-friendly program. What I mean by that is that this is not a program that requires you to go to a gym and lift heavy weights and moan and groan.
Mhm.
A lot of my patients would rather not join a gym. They'd rather do it on their own at home. And they don't have, in some cases, access to a lot of equipment. You don't need it. It's using your own body weight. It's teaching you how to contract certain muscles in your body that you might not have used before that are going to have a dramatic effect on your posture, spinal alignment, breathing. And the most important part of our program is that if you do this program, you will reduce, according to the physical therapy and medical literature, the likelihood of a compression fracture by almost 80%. And once you get a compression fracture, that's a difficult animal to manage in some patients because it can be very painful. And then that goes back to the fear component you talked about. Then they become fearful of movement in general. And now you're dealing with a very, very difficult patient because they're afraid to move, they're afraid to do certain things. So we can help them conquer their fear.
Mhm. And in addition to the wonderful effects physiologically, I know that you also address just simple pain issues that come up surrounding some of these conditions and diagnoses. And I imagine you tend to see a lot more comfort with movement as people get into better alignment and activate certain muscle groups.
Yes, we do. In the physical therapy approach for this type of patient, we will use manual therapy. As I've mentioned to all my students who rotate through my clinic and all the clinicians that I've worked with, these are our most powerful tools, our hands, the ability to use tactile feedback. And that's very important for patients because visual imagery is also something that we use a lot. They might not understand a term like the scapular region, but they might understand the wing that's in the back of your
Mhm.
shoulder. So we have to use that visual imagery to bring it to them so that they really, really comprehend it. Yeah, so that's really the approach that we take as far as the education of the patient goes.
Mhm. Well, and I know I took this course 20 years ago and it was fantastic then. I've used the material continuously, regardless of patient populations or environments that I've worked in. So I know folks will be lucky to get access to this information. I've always appreciated the simplicity as well as the introduction to concepts that a lot of folks don't necessarily get exposed to. Any closing thoughts you'd like to share about the course?
Well, that's an interesting thing because I will speak routinely that this program, this exercise approach is not just for patients who have osteoporosis or osteopenia. I've used this on high school backpack syndrome. I've used
Mhm.
it on whiplash injuries. I used it on adhesive capsulitis. I've used it on spinal stenosis, low back pain, lumbar strain, even some hip pathologies. And when you think about it, Holly, we know so many people who need help with alignment of their body. It goes back to the old thing in school. Your teacher used to say, sit up straight, sit up straight. Now, as a child or as an adolescent, you really didn't pay attention to it. As more people become in tune with their body and realize that, wow, I really need to do get better, but I don't know how to do it,
Mhm.
that's where this course steps in. This course steps in. We've just got to get the word out to more individuals that this is a program that can help them not only in the short term, but in the long term. Because I tell them this is a program for life. Routinely, I'll get the question, how often should I do this? I said, it's like everything else. As a physical therapist, we're going to tell you we want you to continue to work, exercise for the rest of your life because that's going to improve the quality of your life. So it's a great course, lots of fun. Deb and I have a lot of fun teaching it. We do a lot of hands-on things, even though it's in a virtual environment. We do a lot of lab-based things, even though it's in a virtual environment. And we look forward to meeting people from all over the globe now.
Wonderful. Well, thanks so much for joining me for this interview.
I appreciate it, Holly. Thank you very much.